What genetic tests are used to diagnose CLL, and how are they performed?
As a part of routine evaluation of CLL, we do a complete blood count where we look at the number and the type of blood cells in a patient. So in CLL, often we see an increased number of lymphocytes, which are a type of white blood cell that are commonly elevated in this disease. Another type of blood test that is performed for diagnosis of CLL is called flow cytometry. The patient's blood sample is analyzed in a device called a flow cytometer, and that helps detect the surface proteins that are present on these lymphocytes. And this helps in determining the specific types of lymphocytes that are detected in patients with CLL. Another blood test that is sometimes performed are molecular and cytogenetic tests, such as fluorescent in situ hybridization or FISH, as well as next generation sequencing or NGS.
What is a complete blood count, or CBC?
CBC or complete blood count is a type of blood test that provides information on the number and the type of blood cells in a patient. So this is a routine test that is performed in the initial assessment of patients with CLL. And in CLL patients, there may be an increased number of lymphocytes that are a type of white blood cells that's commonly increased in CLL.
What imaging is used to diagnose and monitor CLL?
Imaging may or may not be a part of the initial diagnostic evaluation of CLL. In certain situations, based on a patient's symptoms and their medical risk factors and medical assessment on the physical exam, imaging may be recommended. We commonly used a CT scan in the initial diagnosis and assessment of patient CLL, and sometimes a PET scan, which is positron emission tomography, is recommended in the initial evaluation.
Is there genetic testing that should be done to tell someone about their CLL?
Genetic tests are a very important component of assessment of patients with CLL, and this helps in determining the genetic profile of a patient with CLL. There's a number of complex diagnostic tests that are used, but some of the common ones that we use in routine practice are fluorescent in situ hybridization, or the FISH test. So this is a molecular genetic test that is used to look for specific gene alterations in CLL. This uses fluorescent probes to look for DNA sequences that are associated with genetic changes. For example, in CLL, some of the genetic mutations noted are TP53 mutations, there's ATM gene mutations, and some of these other ones that can be detected by FISH. The FISH testing is relatively commonly performed in the initial diagnosis and evaluation of patients with CLL. Another test that is used is next generation sequencing, or NGS. The next generation sequencing is a complex test that provides simultaneous assessment of multiple gene alterations in CLL. So this provides a comprehensive assessment of the various genetic alterations that are possible in CLL, such as TP53 alterations, Notch1, ATM gene, SF3B1 mutations, and this helps in determining prognosis in patients with CLL and also guide treatment decision making.
What can genetic testing tell you about someone's CLL?
Genetic testing in CLL can provide more information about the genetic profile of the CLL cells. There are genes that are associated with slightly better prognosis in patients with CLL, whereas there are genes that are associated with adverse prognosis or inferior responses to treatment. There are genes that predict chances of relapse or time to progression as well. This is an important information that helps prognosticate patients early ahead of time and help determine treatment decisions as well. The information gathered from this genetic testing helps in identifying specific genetic alterations that are unique to a patient's CLL, and this helps prognosticate patients and stratify them into specific disease risk groups that will help predict progression of disease and also help guide treatment decision making.
There are risk stratification tests that are performed after the diagnosis is established. These include a panel of FISH tests, including looking for P53 deletion, which is the worst of the group. Then there is a minority called 11q deletion that is second in terms of its prognostic impact on the FISH panel, and 13q deletion is actually not that bad, and 12 chromosome 12 deletion carries a favorable prognosis. You also look for the mutation in the immunoglobulin heavy chain gene, and if you have what we call an unmutated phenotype, that has a higher risk than a mutated phenotype.